Okay, Pamela, you're good to go.
All right, I'm going to introduce us. I'm Chris Kukta with Connections Area Agency on Aging. I'm a service navigator or options counselor as long as I can't even talk, as well as being regional marketing. So thank you for coming. I'll let Pam introduce herself.
I'm Pam Worster, and I work at Connections, and I am the Iowa Return to Community Coach for Woodbury County, and you're probably wondering what that is. So you will find out here in a little bit. It's part of my presentation. My program just helps people when they're leaving the hospital to be successful when they go home. So we've kind of included that in our little speech today. So.
Okay, perfect. I have to do a little personal piece in front of here. I didn't know when we had set this up last year, Mara, that I was going to be having knee surgery coming up really soon. So I've learned a lot in doing the research for this and putting the presentation together. So let me share my screen. Hopefully I can get the right one here. I think it's that one. We'll find out in a moment. Are you seeing my duckies?
Yep. Okay. Duckies are there.
They are. So, no one knows exactly for sure when an acute problem will strike or when a chronic disease or condition will suddenly worsen. Experts say that taking a few simple steps to prepare and organize at least some of your healthcare needs can keep you in the driver's seat if and when the time for hospitalization arrives. And this is really important for you, not only yourself, but also your loved one, whether it's a chronic condition or just getting along in years. You need to become familiar with your future healthcare needs, having a discussion with your doctor. Ask what to expect and learn about your treatment options. And make sure you research credible sources. Dr. Google probably isn't always the best source of things that to know about what's going to happen. So make sure those sources are reliable. We often send people to the National Institutes of Health and Institutes on Aging to find more about chronic conditions. Okay. Just a minute here. I've got something that popped up on my screen. Gotta love it, don't you? So make sure you communicate your knowledge of the disease and the disease progression with your support network, whether that's your children or your loved ones, people who would be helping to care for you or care for the person that you're caring for. That allows them to have a sense of what may happen in the future and to know what your wishes are and how to better help you. Let's start in that whole process of what we need to do. Isn't that kind of fun? All right, so let's move on to the next slide. So make sure that you prepare yourself. Make sure you prepare by talking to that doctor. Know what to expect from the condition or the procedure that you will be undergoing. Ask about the medications that you'll need to take or stop beforehand. Make a list of those medications. I keep a list right on my phone for both myself and my husband that I take care of. Okay, so that's a really good option because I have it with me. I can make those changes as a doctor is telling me what's happening with those prescriptions. I can write notes and have those on when to stop certain medications prior to a procedure or how they're going to change later on. And then make sure you also have a list of your allergies or past reactions to medications. They tend to ask those things, but make sure you have it in a written form so that you remember each of those things for the future as well. Another preparation piece too is to know about your heart attack or your stroke risk. Have you had any blood clots or deep vein thrombosis in the past? Do you have bleeding issues? Talk through those things with your doctor to know that risk factor. And then consider if you're going to need medications to control that to protect your heart or prevent blood clots during and after the course of that surgery. Pam, do you want to speak to that a little bit?
Yeah, just, make sure that you are organized and have everything in place before you go to the hospital, I guess, and just kind of, I guess I know personally because I've had blood clots and deep vein thrombosis. So yeah, it's very important to, talk to your doctor to make sure that everybody knows, the surgeon, the anesthesiologist, that everybody knows your risk.
Yep. Okay. And then also talk to the doctor if you're going to make dietary changes beforehand. Are you diabetic? Are you going to have to make sure you stock up on carbs before the surgery so your blood levels or your blood sugar levels don't drop too far? Are you going to have to stop taking, you're going to be on a blood thinner? Will some of the foods affect that blood thinning capacity or make your blood even thinner yet? Are you anemic? Will you need to take some more blood iron kind of supplements or add iron dietary products to your menu? Am I making sense there? Okay, so you need to ask those things. And when you do, when do you need to stop eating prior or drinking prior? Is it safe to still take your medications and which ones? Okay. So another part of the preparation process is to know also what procedures you're going to have before or after. Will you need some CAT scans or MRIs or X-rays prior to that, to the surgery or the procedure you're having? And how far in front of it is it okay to do that? The same thing if you're going to have a pre-op exam with your primary care physician. How far out is too soon, or what is that window of opportunity that is best?
Oh, sorry, that's Max.
Yeah, I think he was barking in response to mine barking just a moment ago. And I slid out and closed the door. So yes, we both have dogs, and it's part of this life now when we're on Zoom that something's got to happen, right?
Yeah, and I just took him out too, so I thought he would behave himself, and he has been sleeping. So he just wanted to say hi, I guess.
I think so. All right. And then as you're talking through procedures and things, you need to make sure you have the insurance in place. What is my insurance going to cover for the procedure? What is my copays and deductibles? Am I going to have to set up a payment plan with the hospital or the place I'm having my surgery? What's going to fall into that pre-authorization? You don't want to end up having a surgery and find out later it needed to be pre-authed. I'll have to give an example here. I had my colonoscopy when I turned, I don't know what age, someplace between 50 and 60. And literally I was on the surgical table, half doped up. The surgeon came in and said, oh, we probably should go ahead and do the upper endoscopy because you have acid reflux and we should do that. He didn't tell me it needed pre-authorization. And I ended up paying that whole procedure myself because the insurance didn't cover it. So talk those things through. Make sure you talk to the surgeon and say, you're not going to do something like that at the last minute, are you? And if it is, does it need pre-authorization? Okay. And I suspect that surgeon probably knew it needed pre-op, but I can't prove that one. So that's important because you don't want to end up later on with a bill far beyond what you can pay. Another piece that I had picked up in my research was time your surgery for the best well-staffed times in the hospital, if you can do that. I mean, sometimes you don't have a choice, but they say that weekends and holidays in the hospital tend to be understaffed. We know that. So you're probably not going to get the best care during those times. Mondays often have surgeries bumped into them, so you're likely to have your surgery bumped into later in the day or later in the week. So it's best if you can to schedule your surgeries for Tuesday, Wednesdays, or Thursdays to have that most staffing in the hospital and that least chance of being bumped over. Ask the doctor too on what your expected length of stay is going to be, because that's going to affect your preparation at home. and what you're going to need to have in place for other loved ones. And then ask too whether you recover at home or with a family member at your family member's home, or if you'll need to go to a care facility to rehab before you can go home. Of course, we always say prepare your medical powers of attorney and your living will documents. So you have those in place, and you've spoken to the people that you've given those rights to, that they understand what your wishes are should something happen. Okay, we hope nothing ever happens, but it's always best to have those in place. We tell every adult, no matter the age, you should have those in place. So Mara, even though you're younger, I hope you have your powers of attorney for medical in place, and legal is also pretty good too. If you're looking at possibly having to use a transfusion, you can ask about banking your blood so that you're getting your own blood. And then also, if you can quit smoking, that's also a good idea, because you won't be able to smoke in the hospital anyways. And smoking slows down the healing process and increases your chance of infection. So it's best if you can stop smoking. Okay. All right. So, whoops, we just went through all that. Sorry, I just didn't move my slide in time. Okay. So I'll give you a second just to catch up on what we talked about there. So we talked about procedures, we talked about changes in medications, any changes in dietary and lifestyle changes, pre-op procedures, exams, and such. So, okay, we'll let Pam take over here.
Okay, which slide are you on?
So we're gonna jump to the next slide because we just covered all that as well.
Okay.
Okay, there we go.
So before you go to the hospital, you're going to want to find out about, find somebody to take you to the hospital if you can't go. And something else that I know that my daughter just recently had her tonsils out, and, due to COVID, my husband and I both couldn't be there. We could only have one person. So right now, during this time of COVID too, you might want to ask, what are the COVID restrictions? Because only one of us could go to the hospital with my daughter. So, and I did when I got to go. So, but make sure you check that out, because different hospitals and surgery centers do have different, COVID restrictions at this time. So just make sure you have that, somebody to take you and to be with you. And we can't forget about our little pets. You need to make sure that, you have somebody to take care of your pet when you were there as well. Because, Max can't handle not going out all day. So you're going to want to make sure you have somebody to take care of your pet. So maybe let your neighbors know what is going on too. So if they, see you or don't see you around, it's important to let them know as well. Something else you're going to want to check on is who's going to help you with meals and do those household chores while you're gone. So maybe check with a family member, a neighbor, church friends. I know those are kind of people I depend on when I have to have a surgery, or my husband. So make sure you let people know and you do ask for help, because sometimes people don't always want to ask for help. And a lot of times the elderly people, that we work with, sometimes they're a little bit stubborn and they don't want the help, but, they need to make sure that they do get that help.
I'm going to jump in here too, Pam.
Sure.
Up to the point of caring those you care for, I care for my husband, and he's not safe for a length of time on his own. He's okay during the course of a day, but day in and out for a number of days, it's really important to make sure we have that in place as well. So, okay. Terry, can you mute yourself, please? Okay.
Okay, so like I said, you're going to want to make sure you have somebody to help you do all those things and be prepared and have everything organized. So choosing an advocate, make sure you have someone that is there to help you and to monitor your care. And, if you're not able to ask questions, make sure this person is aware of what is going on, because sometimes that's important. After you get home from a surgery, you might be a little bit tired from the surgery, or you might be a little bit loopy from the medication. So you're going to want to, have somebody there to act for you and be responsible. Make sure you ask questions and take notes prior to going home or prior to surgery if you do have questions. because you like I said, after you have that surgery, you might not be as aware. So you're going to want to, take notes, ask questions of the doctor, of the staff, especially too, before you go home.
When my grandson had surgery, technical terms they used were so complicated when they came back to explain what was going on that one of the adults who was there in the waiting room, and obviously this is pre-COVID because there were several of us in there waiting, asked the doctor, is it okay if I record what you're telling me? Can I put this on video so I understand and I can look up these terms later and make sure I have this correct? And you do have to ask that permission. Some hospitals allow you to do that. Other facilities do not. But it's a good way to get that information down in a way that you can go back to and look at again. Okay.
So another thing you're going to want to ask for is like, what kind of equipment are you going to need? Do you need anything special? Are you going to need inhalers? Are you going to need like a nebulizer? Are you going to need, a walker if you've had knee surgery, or a cane or anything like that? So you're going to want to, know what to expect after you have that surgery, because you're going to want to have that on hand when you get home. So you're going to want to check out, your options. What will insurance pay for? Can you borrow it from a friend? So those are some things that you also need to check into, is if you do need any equipment after you go home from the hospital.
I'm going to jump back to the advocate piece just for a moment. That is also going to be really important during the time that you're recovering. So this is the person that's going to be checking with the nurses daily to see what happened in the rounds if they can't be there during the time the doctors make their rounds. It's a person that's going to help monitor your visitors as well. And if they're noticing you're not getting the rest you needed, or you're getting really tired, or you really don't want company, they need to be the ones who say, nope, sorry, let's go down to the waiting area and talk together, or down to the lounge area, so that you can recover while your advocate may entertain them for a moment. And, those people can peek in for a moment, but then she shoos them out of the room, or he shoos them out of the room for you. So then you're not the bad guy, and you can actually recover as you need to do. Okay. All right.
And then this is the things that you probably want to take with you when you go. You're going to want to make sure you have a complete med list. A lot of times I know, like when I've had surgery, I just had a recent surgery in September, the nurse, they will call you and ask you all these questions. But just in case, always carry a med list with you, with all the medications and the dosages, so that they're aware of what meds they're on. Because sometimes what the hospital has or what the clinic has might not be actually, sometimes they miss out on that. So you're going to want to make sure you have the right list. Something else I know that helps, and that also helps me, I always have my headphones. I have all my music on my phone, so I will always take my headphones and have that music, because that helps relax me. So I think that's important too, to have that, have some music playing, or even, they do usually have TVs in your little room before surgery. So it's nice to have something to help you relax. You might take something like a comfort item, whether it's a warm, cozy blanket, a favorite photo, or picture of your kids or something like that. It's nice to have something, a comfort item, to have there with you as well. It's also important to have your cell phone, and don't forget that charger. That's always sometimes something that I always have to run back in. Oh, I forgot my charger. So make sure you also take your charger. And then also make sure you have a list of those important phone numbers of people they can get a hold of. Obviously you'll have your first contact there with you, but let them know, have a list of important numbers, whether it's your, anybody in your family, your spouse, your children, brother, sister, mother. Make sure you have a list of those that are secondary in contact as well. Make sure you bring the basic toiletries, toothbrush, toothpaste, hairbrush. I think it's important. Chapstick, that's always one thing I always forget, but that's something that is really important, because your lips will get very dry, from having all the procedures done. So that's something very important to always bring, is your chapstick. Sometimes they'll let you wear your own pajamas. Otherwise, sometimes you have to wear the gowns, but you can take comfortable sleepwear. I know I have done that before in the surgeries I've had because I'd rather be in my comfortable sweats than those lovely hospital gowns. Take something to do, like take a puzzle book, I always like a tablet to play my games on. Something to, I'm sorry, my phone is ringing. That's always something important too. Just take something to keep you occupied. Help in the hospital, take some magazines as well. And leave your valuables at home. Usually they'll tell you at the hospital, take your rings off. Don't bring any valuables because you do not want to have those because normally you leave them in the hospital room or with your loved one. So it's best just to leave everything like that at home.
I'd also just share in terms of the cell phone charger, having a portable charger is ideal because I feel like the plug situation in a hospital room is not great. So if you have a portable charger, that's pretty helpful.
Right.
I recently read something on staying in a motel, and the TVs anymore tend to have the USB ports. So if you can't plug into the wall, that's another place you can look that you might be able to plug in and charge your phone, assuming that it's not clear up on the ceiling and your phone's going to be dangling, right? That's probably not the best look. But yeah, that's a choice. And the photo too, especially if you're taking care of a loved one in the hospital, it's not you being hospitalized, but your loved one, and they're older or they're really sick. Lots of times it helps to have a photo of them in their vibrant life that's making sense. So they see that person in the bed who doesn't look like their normal self as a real person who has value. So it's not just a patient, but it's somebody that we care and love. So it's helpful to have that kind of photo as well. Okay, so, all right. Okay, so Pam, you ready to check us all in?
I am ready to check you all in. So you're going to want to have your insurance cards. That's one of the main things that, they will ask you. A lot of times they will call you and, they'll already have that information, but just double check to make sure that they have the right information. I know just an example that I had surgery on September 1st and our plan went until August 31st. So on September 1st, I was getting a new card, but I did not have that information yet because we hadn't got the new card. So just make sure that you give them the most updated information. Take your medication list, as I mentioned earlier, because sometimes they might not always have the most accurate list or the accurate doses. Even tell them, the medications that you take that might be not, over the counter, like your vitamins, those kind of things as well. Introduce who you have with you and who's going to be there to support you and, who's going to be there to get those instructions. So make sure that you introduce those persons to them. Sign releases. They will ask you to sign papers. We all have papers to sign when we're there. So make sure, you'll that you have, usually you sign them at the beginning and then usually the person that is with you will sign them at the end because you're not with it at that time. Check your wristband. They'll give you that wristband. They'll always ask you, is your name spelled right? Is your birthday correct? And also make sure that you have your allergies listed. Usually they give you a different color band for allergies. And a situation happened when I had surgery in September. My doctor was going to give me a medication that I was allergic to. And the nurse is like, she can't have that. She's allergic to it. So do make sure that, they do know what you're allergic to and have your allergies listed. But I guess get autographed. I'm not sure what that one is about, but Chris, do you want to say what that one is? I
do. I'm going to back up a couple things too. With insurance cards, if you have a hospitalization from the emergency room, you don't have your cards with you, they do allow a time for you to be able to get those cards to the hospital for billing. So if you don't have them, don't worry about it if it's an emergency. And with your med list, also bring your meds in a bag, especially if you're going to be doing an outpatient stay and on Medicare, because those meds are not covered. And if they're your daily routine meds, they possibly, not every facility will do this, they possibly can send them down to the pharmacy to make sure that they are what they say they are, and then allow you to take them from your own pill bottles, and that will keep your costs down in the hospital. And if you don't need to take something, and they're, you know, like if you're going home after an outpatient stay, and you don't really need to take something until you get back home, you can refuse to take their med at the hospital they're going to charge you for, okay? So that's your choice. And then the get autographed is if you're going to have a procedure like my knee replacement that's coming up in June. I want them to autograph the correct knee, that this is the one they're going to do. Oftentimes they'll put an X over the wrong knee to make sure they're doing the right procedure on you. So that's what the get autographed is. So
oh, okay, I remember that now. I was like, what
marking
is
the
that?
site. Yeah, make sure they're marking the site of where you need to be. So, okay, so let's move on to when you're in the hospital, what needs to happen. The major thing is after your procedure is done is that you rest. That rest is so vital for your healing. It's going to increase that immune response. It's going to make it go quicker. It's going to help you regain your strength back. So, you know, even though you have visitors who want to come see you, you can tell the nurses, no, I don't want visitors until I wake up. You know, do not allow someone to come in and knock on my door and wake me up. Okay, unless it's a staff, and they're going to do that all day and night anyways, right? Okay, so monitor your meds. So that can be you or your advocate, making sure you're asking what they're giving you, why they're giving it, what it's for, why it's necessary, what the dose is. I remember when I was after childbirth, they kept coming in with the stool softeners, and I was young and dumb. I'll say that right up front. And so I never have trouble that way. But by the time that I realized I could say, I don't want that, I already had diarrhea. So you don't want to get to that point. So ask, do I need it? What is enough? Okay. And then pain management, you want to stay ahead of the pain so it doesn't become so overwhelmingly bad. So speak up when the pain is bothering you. But don't aim to be knocked out so that it would slow down your recovery or increase your fall risk. But you want enough to keep you on the edge of that pain management piece. Okay. Make sure you have standing orders for the doctors for medications that might be needed. So some of those might be, again, a stool softener, something for constipation, because oftentimes the anesthesia excuse me, will cause you to become constipated. You might need a sleep aid in order to sleep. So if you have those ordered and ready to go, that's so much better than having the nurse call and that doctor's not available and his nurse may not call you back for hours, or if not the end of the day, and you've been miserable the whole time while you've been waiting for those meds to be ordered. Okay, so if you could have those standing orders on, ready to go with the surgery itself. And then insist on clean hands. Make sure that anybody coming into your room, whether it's the doctor or the staff or your own visitors, the first stop they make is right there at the sink and wash their hands before they even come in and give you a hug or touch you or do a procedure on you. It just doesn't hurt to stay alert to that. I think the staffing tends to do that even more now with COVID, but it doesn't hurt to still keep an eye out, making sure they have washed. Also ask if everyday things like catheters, or ask every day if catheters, ventilators, or other tubes can be removed. You don't want those in any longer than they have to be in, because the longer they're in, the greater the chance of infection is. And then watch for unnecessary tests as well. Again, just like the meds, ask for the purpose of that test. and ask who ordered it for you and how soon you actually have to have it done. Okay. And then you also want to get up and get moving. I think the staff in the hospital is very aware of the longer you stay in bed, the more chances you have of getting pneumonia or lung infections going on. So they do want to get you up and get moving. The other piece that the longer you stay still is the blood clot issue as well. So get up and get moving. It helps with those blood clots. It helps with bed sores. If you are bedbound, then make sure you're asking for special pads or those pneumatic stockings. Those are the coolest things. They sit in increase and decrease pressure, and they also have the beds that are the air beds that, again, move you a little bit during the course of the day so that you're not sitting on one spot constantly and end up with a bed sore. I was surprised to learn too that the reason they do the warming blankets at the hospital is it increases your immune response. When you are cold, your body is not able to heal itself as quickly. So make sure you're asking for those nice warm blankets. I think that's the best thing of being in the hospital anyways, is blankets. Okay. So make sure you have enough of those. So even when they cool off, if you need another layer, don't hesitate to ask for those or have your advocate ask for those. Okay. And that gives optimal blood flow, and that again increases your immune response. Again, you want to stay alert and voice your concerns. If something just doesn't seem right, ask about it. Like Pam did when she said when the doctor was going to order the medicine and the nurse stepped in, but sometimes that nurse is not right there and you're going to have to ask those things. Okay. It's going to prevent errors to do that. Okay. Pam?
Okay, so when you're getting ready to get discharged, make sure there's usually a discharge person there, whether it's a social worker, a discharge planning nurse. There will be somebody there that will, discharge you and give you that paperwork and go over it with you. One of the most important things to do is to make sure you're ready to go home. I know when I'm in the hospital and I've had to spend the night, I want to go home the next day. Do I feel 100%? I might not always feel 100%, but I would much rather be at home and not woken up every night, every few hours for the blood pressure cuff to go off. So I would much rather be home. But if you're not ready to go home, make sure that you tell them that if you're feeling faint, if you're feeling sick, nauseous, if you can't go to the bathroom or move your bowels, make sure you are honest and let them know, because and if you go home too early, you don't want to end up going back to the emergency room. Make sure your home is a safe place is also a safe place for you to recover. Make sure you have, are there steps in your home? Can you get safely to the bathroom? So just make sure that you have safe places and that it is a safe place for you to recover. Before you go home, now they should give you the discharge instructions or discharge summary. They should go over that with you, but they should always give you a copy of that. So make sure you get a copy of that, because that will tell you the list of meds that were made, and it'll also tell you the meds that you were on. I know when I was in the hospital, it told you the meds that you were on or that you were given when you were in the hospital for pain. So if you don't remember, you get home and you don't remember when the last time you had your pain pill was, you can look at that discharge instructions and that would be able to tell you. And make sure you understand things when you do go home, that you don't have questions. Ask the questions before you go home so you don't have to call back. Make sure you ask the other questions like how to care, like if you have a surgery site, make sure you ask how to care for that surgery site and what to do for that, or if it gets infected, what do you do? Ask about activity. How active can you be? I know I always want to, sometimes when you get home, you feel really good because you've had all these pain pills and you just feel wonderful. And then once you get up, you realize you really don't. So make sure you ask them about activity. How long should I be, laying around? When should I get up, or what can I do? When can I drive? Those kind of things, because those are important to ask as well. Ask about when you can return to work. Make sure, they give you that instructions, and they should also give you a piece of paper that tells you, how long you need to be off work as well. And also ask about your diet. Is there any dietary instructions or anything like that that you need to be, worried about? Well, list of supplies. Make sure you they give you a list of supplies. If there's something that you need, that you make sure. Sometimes they can order that for you at the hospital, and you can pick it up at your pharmacy or Walmart or whatever on the way home. So make sure that if there is something special you need, that you ask them to call that in for you. And then transportation, make sure, first of all, you have a ride home. You need to have that ride home. And then you also need to make sure that they have those follow-up appointments scheduled for you. They should be able to call the doctor's office and get that appointment scheduled for you. And it should also be on your list, on your discharge summary list. So make sure you write that down or put it in your phone or your calendar so you know when that next appointment is. And I don't know that there is a program too that I do that also helps people when they do go home. I'm not sure, Chris, are those slides next, or do you want?
They're at the end. They're at the end.
Okay.
But Pam, I'm going to jump in too, because readiness to go home. If you're in the hospital inpatient for 3 days, or are planning to go to a rehab center, you have to have 3 midnights in the hospital. Okay, for Medicare to cover that following a hospitalization. So, if you're going to head straight from the hospital to the nursing home to rehab, and they're going to send you after 2 days, you may want to be talking to the doctor and seeing if there's any possible ways to stretch that out to another midnight so that you do have that Medicare benefit. Okay. And there are appeal processes in that whole bit to go home. If you have a Medicare Advantage plan, chances are they're going to get you out of that hospital as quickly as possible, whether you're ready or not. And again, there's an appeal process that they have to go through if you say, no, I'm not ready to go home. Okay. So that's really important to know. And I think we talked about the meds already, the inpatient, outpatient meds. So let's just move on then. So Pam, do you want to take it again?
Sure. So when you're at home, the first 72 hours are very crucial, for you. So make sure you're getting your proper rest and that you're drinking a lot of fluids. I know that's something that I always struggle with, is, drinking fluids, because I'd rather sleep than drink fluids. But, make sure you do keep up on those fluids to keep you hydrated, because you don't want to end up having to get readmitted or go back to the hospital for that. Do make sure that you also are good nutrition. Are you following through with your dietary orders? Are you, avoiding caffeine? Are you, following the orders that they give you? And make sure you do have, if there is this dietary restriction, make sure you have that food available in your home. Nowadays, if you don't have it and you don't have anybody to get it for you, there are, you can always order food online, have things delivered to you as well. Also, are you able to prepare your food? So if you're not able to prepare your food, make sure that you have someone that can help you prepare food. Now, my husband is not one that likes to cook, so he will just usually order something or, bring me some ice cream or something home. But make sure you have somebody that can, give you those things, help you cook your meals. I also talked about shopping. Make sure you have somebody that could do your shopping, buy you your groceries, or you can do that, order the online options as well.
Pam, I'm going to jump in with Meals on Wheels. Yeah, Meals on Wheels can come in for people who are 60 and older, even just for a short rehab period like this, when you are basically homebound. So we get people who come on for 2 or 3 weeks until they're strong enough to be able to be out and about and their normal selves.
Awesome. And medications, you're going to want to make sure you have all your medications. Like when you leave the hospital, the doctor should call in anything for you that you need. So you're going to want to make sure you have all your meds, including your new ones. And so you're going to want to make sure that you also have them available to you at home. If you're not able to pick them up, sometimes there are some pharmacies in town that do deliver. So you would just have to call them and have them deliver and tell them that you're home. You're going to also want to make sure are you going to have refills on that medication? So, plan ahead If you're out of pain pills and you need more, because usually they only give you a certain amount, then you're going to want to be on that phone, talking to your doctor about, hey, I'm still in pain. Can I get refills? So you're always going to want to talk to them about that. Say if you're caring for a loved one and it's somebody that has memory issues, you're going to want to be able to help that person with their medications, or how are they going to take their medications if they do have those memory issues. So you're going to want to make sure somebody is there that knows what's going on with your medications. Hygiene. I guess one of the things you're going to want to look at is, are they eligible for home health care? This would be like, sometimes your Medicare will order physical therapy, occupational therapy, any other services like that through home care, bath aid. So you're going to want to make sure, are you eligible for those, and make sure that the hospital gets you signed up for those and has a company coming in, because they're usually pretty good at visiting you within that first 24 hours that you're home. Chris, do you have anything to add on that at all, or not, with the home health or anything?
Well, with home health too, is if you're needing help with a wound care, changing Band-Aids, putting on braces, those kind of things after a procedure, that can be ordered too with your Medicare.
And then therapy and follow-up, you're gonna, usually you get your, once your therapy comes into your home, usually Medicare usually approves it for about 4 to 6 weeks is usually about the average. So you're gonna wanna make sure, that if you need therapy further, that, talk to them about that, because then there are ways you could get outpatient therapy as well if once your therapy is done, if you feel like you're still not strong enough. So make sure you're always talking to your doctor about, how you're feeling and how you're doing, and if you're stable on your feet. And make sure you go to your follow-up appointments. That those should be scheduled for you, and they should also be written on your discharge instructions. So check to make sure that those appointments times work for you, or work for you to get transportation there, because the follow-up appointment is really a very important appointment to miss, not to be there. And we do have options at Connections as well to help people get to rides. If for some reason they absolutely cannot get on a ride, we do have community benefit funds that would help somebody in that emergency situation to get to that doctor's office. And rest, one of the most important things to do is to rest. I know it's hard for me, because I'm not a person that likes to sit around and do nothing. And my husband is one that likes to do those things. So you want to make sure that you do rest, you don't overdo it. Don't have plans, don't have people over, don't have, if you're not ready for visitors, don't have people over. You're going to have to make adjustments in your routine. And you're going to have to, my husband's going to have to help me with the laundry, because I couldn't carry things when I had my surgery. I couldn't go down the steps right away. So you're going to want to make sure you have somebody that can help you do those household chores as well. And one of the other things to look, say, an elderly person is home alone, they might have to find somebody or have a caregiver that would help them during that recovery. So that would be something you'd also want to check in before you went to the hospital. If you didn't have anybody to care for you, you'd have to make sure you found somebody. And then you're also going to want to make sure you have all that equipment, that you're ready. If you want to take a shower, because I know that's the first thing I want to do when I get home, is take that shower, get all the sticky stuff off from your bandages and all the, where they had drew blood. I want to take a shower, but you need to make sure that you're ready to take a shower and that you have the proper equipment for that, or have somebody there. I know one of the first things I always do when I get home, if I do take a shower that next day, I make sure that somebody, if my husband can't be here, my mother-in-law would come over to make sure that I was there. I was okay when I took that shower. So I don't know if you have anything else you want to add, Chris, about going home, and then I can, Jenna, when you want me to talk about my program, but I can definitely do that as well.
Well, I think it's important to realize that, if you don't have the family support or the neighbors or the church support, your faith community, make sure you reach out to those as you can. But also there are the home health agencies around that can provide supports, whether they're bringing in somebody to do homemaker services for you that can help prepare meals, go grocery shopping, do your laundry, change your bed, because definitely you want a clean bed during that time period as well. So don't hesitate to give Connections a call. We have lists of those providers if you don't know of one available to you that's not recommended to you before. And then that equipment, that range of equipment is huge. We touched on it earlier, whether it's the commode sitting beside your bed, and a commode is a portable toilet, whether it's, again, wheelchairs, walkers, canes, all that durable shower chair. Absolutely. I know when I had my knee scope before that, the facility provided me with a big long bag that had a flange at the end that came up over my knees, so I could take a shower and not get the surgery site wet. So again, you ask and you think about, what am I going to need? It might even be a reacher, one of those grabber things that you can reach up high or down low, so that you don't have to bend, or just makes it easier for you. Okay. So talk through all those pieces and try to get that equipment in place before you go home, rather than try to scramble to get it after you go home. And again, that's something we often at Connections will have donated equipment. So if you don't want to buy it and you just want to borrow some for a length of time, as long as you need it, you can do that. If you want to try some things out ahead of time, Iowa Easter Seals has a lending library out of Des Moines, and they can make arrangements to get it up here. So that's also another source for some equipment, especially if you're going to need some more expensive type equipment. And the other piece I'm going to throw in here too, Pam, we didn't talk about this. I'm sorry, I'm just going to throw this out of the blue, is that if you or a loved one are in your last days, don't forget to talk about hospice and all the different aspects that hospice can provide, whether it's in the home, in the nursing home, in the hospital. Hospice can be there. And eventually we'll have a hospice house up here as well. And again, what the hospice does is absolutely amazing. And you don't have to wait until those very, very final days to put hospice in place. Okay. So Pam, let's move to the fun part for you.
Oh, yes.
Okay, let's change my slide here.
Okay, well, right now Connections does have a program. It's called Iowa Return Community, and that's what I do. I am the coach for Woodbury County. So pretty much what the Iowa Return to Community does sorry, I had a phone call. I should have turned my phone off. It helps people when they go home from the hospital. It's a grant that was funded from the IDA, and Connections was able to get that grant. So what it does is it helps people when they go home by providing them those services. The goal of the program is to try to stop them from being readmitted into the hospital. So, and this is done through putting services in there for them, such as Meals on Wheels, transportation, getting them to that appointment. A lot of times the seniors also can't go home and clean their house. So those are some things that can also help with, this program can help with. To be eligible, you have to be 60 years and older, a resident of Iowa. So, I mean, you couldn't be from Dakota Dunes or live in the Dunes. You have to be from Woodbury County. And then there are 3 other counties that do it as well: Cass, Mills, and Potawatomi County. There is another one up in northern Iowa that is doing it as well at Elderbridge. The goal is to try to spread the program, I almost said nationwide, statewide. So I just had a meeting about that yesterday, and they really want the program to continue because it's such a success rate. So those are the counties that you'd have to reside in right now. You also have to be being discharged from the hospital, nursing home, long-term care facility, or an ER placement. That would be a requirement as well. You also have to be Medicare, and you can't be on Medicaid, or you could also be on private pay insurance. And the reason for no Medicaid is because if they're on Medicaid, they should have an MCO, managed care organization, assigned to them. So they should be providing those aftercare services. So that's why we are just for the Medicare and the private pay people. They're also, they have a desire to return home. So these people want to try to go home and be successful at their home instead of going to the nursing home. So that's where this program would step in and help. And it is voluntary based. I do have a lot of people that, the families are like, oh, this is wonderful, because they might live out of town and they want their mom to have the program. Sometimes their mom doesn't want it because they're stubborn and think they can do it all by themselves. So it is a voluntary, on a voluntary basis. And pretty much, to get referred, I've had referrals from several different resources. It can be the hospital social worker, it can be a doctor's office, it can be a home health organization, it can be a family member. Hey, my mom's having surgery next week. Do you guys have anything available that could help when, she goes home? Or, a lot of times I know our staff are really good. And a lot of times people will call for the Meals on Wheels. And then they'll say, my mom's having surgery, then they'll refer them on to me. So referrals can pretty much come from anybody or from a professional source as well. And it right now is just, all you have to do is call Connections, and they will hook you up with me and get you involved in the program if that's what you're interested in. But it does have a very good success rate. I think the first year I was here doing this, I think there was over a 90% success rate in the counties that we had. So I think that's why they're really looking at trying to expand it to different places.
I can't tell you how many times we've talked to clients and they've called Pam their angel for what she's been able to do. We had one that went home just on toe touch. She had some surgery on her ankle foot. Was it, Pam?
Yeah, she'd broken. I think she'd broken had some breakage somewhere in her.
Yeah, and she was fortunate to have like a microwave in the lower level of her home, which is where she could enter. But the main level was the second level. So she had a microwave there. She had a bathroom and a shower downstairs, but she couldn't get up quickly. So Pam helped her get a mobile phone, got her to the doctor's appointments, got her equipment that she needed. She was just amazed on it. And she did. She literally called Pam her angel. I think that she would have been able to go home and stay home for that. And in the long term, it saved her money as well to be at home.
Mm-hmm.
Okay. Pam, can you want to give another example of?
Just another example of what I had. A lady, she was like probably in her mid 60s, and she had gone home from the hospital, and then they called her and told her she had to go to the wound center twice daily. Well, she was crying. She said, I don't know how I'm going to do this. She did have a son in town, but he works, and, to have it twice a day, because I think she had to go like 8 in the morning and then like at 4 or 5 at night in the evenings. And she had no idea how she was going to get there. And then she just happened to get a call from me, and not knowing about the program. And I just happened to have her as a referral from the nursing home. Actually had given it to me, and she was just like, oh my gosh, you're an answer to my prayers. And then her tears of sobbing for being sad turned into happy tears, because I was able to get her 22 rides. Not that was all of her rides, but I was able to get her those rides to appointments to help her get there. And I know between her son was able to help out some, and I think she might have had to private pay for some as well, but she was able to get to those appointments because of the program. She would not have known what to do, or she would have had to, outright pay for her ride. So I was able to help out. I mean, I could share so many success stories, medications being messed up. I've gone home. One time I went in and a lady hadn't taken her meds. This was like on a Thursday, and she came home on a Tuesday, and she hadn't taken any of her meds, and she was a brutal diabetic. And I said, well, why aren't you taking your meds? Well, no one showed me how to do it yet. So I was able to quick get on the phone with the home health company as well as the doctor's office. I mean, if they wouldn't have came out there, I mean, she probably would have ended up having a diabetic issue and probably back in the ER. So I feel like sometimes those simple things like that, doing the medications, talking with them about that, is crucial. And I probably have saved some readmissions. I'm not afraid to get on that phone with the doctor's office and say, hey, something's not right. So yeah, a very great program. It's just right now, usually I'm out there about in the community, going to nursing homes, going to the hospital, but due to lovely COVID, we've been working at home. So I've had to do it all by home, and we're still able to do everything by home as well. I can do those assessments at home. It's a lot harder now because, you get that phone call, and then, our agency preaches about scams and don't answer the phone, don't give out information. So when this stranger named Pam calls, then sometimes they're kind of leery on who you are and why are you calling and how did you get my name. So it's harder to do during COVID, but my referrals have actually been pretty decent the last few months because people have been catching on. And I know Chris has been, we've really been marketing the program as well and doing some radio spots and just even word of mouth, just, hey, my mom's having surgery, or, a neighbor, you should call Connections. So that's kind of how we're doing it right now, just because we can't be out there. So
the other piece too with being a caregiver and having a loved one go to the hospital, it increases the load on the caregiver when they come back home. So our caregiver support services are also available. Or as if you as a caregiver are going to be in the hospital for a number of days, we can possibly provide respite in one of the skilled facilities for your loved one for a short length of time while you are in the hospital and maybe even a little bit while you're recovering at home. So to check on those services too.
And I was just going to add, if I feel like after I do follow them for 30 days, if I feel like there's more need for services that I could definitely refer them on to, case management services. And I guess, I do that. I didn't really say what I do. I do the initial assessment and then I call them weekly. So, and then at 30, 60 and 90 days, but it's a great way to, help Connections and give them referrals to other programs if they still need that continuing ongoing help. So that's another great thing about the program is they can continue on with services through a different
Pam, how much does your program cost? I think know that.
It's great. It's grant funded. So everything is contribution based. So, I mean, right now it's great. The grant usually pays for it, but we do send out that contribution statement if you can make a contribution, because those contributions are key in what helps keep the programs going and the success going.
And the same thing is true with the majority of our services. Mm-hmm. So that's a nice piece. So let's move on to the last portion is what happens if you get harmed while you're in the hospital. First of all, and we hope this never, ever happens and you never end up with a zipper on your belly, okay? But make sure you get prompt medical attention. If you fall, make sure it gets documented, make sure they check you over. If you need x-rays, make sure they're doing those things. Tell them that it hurts. Don't just say, oh, I was just clumsy. Well, no, probably what happened is they didn't follow procedures. I have a daughter who's an occupational therapist in a hospital, and she tells me quite often of the little boo-boos that happen. The OT may have forgotten to put the gripper socks over the top of your TED hose, because TED hose are extremely slippery and you shouldn't be walking in those. Or, you go into the shower and the aide forgets to cover your IV site. Okay, and these are true stories that she has told me. They're probably not huge issues, but they could be. So make sure you get it documented, make sure you talk to the primary care doctor, decide on how you're going to proceed, or if you're going to have to go see a different doctor who's independent of the hospital. Ask for a copy of those medical records, including that incident report. You may have to pay to get those records, but it might be worth having those. If a death resulted, let's hope that never happens, make sure you ask for an autopsy. Usually those are performed without a charge and they can get down to what really caused the death. And then if you think you need to report it, make sure you report it to the hospital, hopefully within the reasonable time of when it occurred. And then you also go on to the local or state health department. There's a joint commission. If you're on Medicare, there's a Medicare Quality Improvement Organization for that. If it's a mistake that they've made and it's the consequences of the mistake have caused you injury, don't pay, okay? That's not your responsibility. It's their fault. They should be paying for it. You might have to consider hiring a lawyer. It's very difficult to win malpractice cases because there's a very high standard of proof, but it can be done. But the lawyer may also be able to negotiate with the hospital over the medical bills or the compensation agreements. So it might be worth having the lawyer in place for that. So let's hope that never has to happen to any of us or people that we know, but it's good to have that information in hand. So at this point, we're going to open it up for questions. This is our contact information for Pam and myself. Connections does have a website. It's connectionsaaa.org. And we have an active Facebook page under Connections Area Agency on Aging, where we post all kinds of good information for seniors that's relevant to the times. So follow our Facebook page and check out our website. Okay. Questions? Comments? Tips and hints that you've learned?
It was interesting, very interesting, honestly. I just had a friend tell me that she fell on some ice, just, and the different problems kind of she had. She didn't realize that, she got back home, thankfully. She was taking a walk, and but she had to call somebody, her sister, to come and help her because she couldn't get off the sofa. And so they called an ambulance, and she didn't realize, since it was COVID, they didn't want to keep her overnight for observation, but she broke her shoulder, and she had problems, knee. She was pretty banged up. And so she was stuck with that bill for calling an ambulance because they wouldn't keep her overnight. But, what do you do? She was on Medicare. Just a number of things that she was finding out about her own insurance, that things that they wouldn't, and there's just certain procedures you have to go through before they're going to pay for stuff, which I always think is going to probably get me in the end too, because every plan is kind of different. But she ended up, because she could not walk, so she did rent a lift to get up the second floor for the bedroom, because it was easier for her the bed, it's higher for her to slip out of the bed. But she said that was a godsend to have that automatic lift up to the second floor. But a lot of this stuff she found out on her own, and she had different equipment. She used the potty. I call it the potty chair. That's a lift on your toilet. Toilet. So you can, or it's like, okay. But there's just different stuff out there you don't realize,
There's
that can
an array of equipment.
There was an array of stuff that she ended up getting, I think, pretty much herself, because she had to argue with her provider, her insurance provider too. She said, hey, I'm saving you money here because I'm not in a rehab center, because they wanted to send her to a rehab center because they just thought you're too bad shape, that kind of stuff. And she says, no, I want to go home. So she got all this equipment and has been able to do it. But I think she thought there's probably just going into a rehab center during COVID was probably not going to be good for her either. So,
and I know that a lot of people that I've had are people that are going home, choosing to go home versus a nursing home. And now that you say equipment, I didn't add that part, that is something this program also does provide for simple equipment, obviously not something super expensive, but they do, you know, I've gotten the commodes, I've gotten walkers, I've gotten the reacher grabbers. So those are things that my program could do too. So in an instant like that, if you would have known about the program, that your friend would have been able to, you know, to qualify for that because
Yeah.
it's in the ER and gone home. So that's why it's good to know about these kind of things when you do have situations
Right.
that come up. So
Yeah, and she's only lived here a few years, so I don't think she really,
yeah.
but you know what? Now that I think back, right away, she did volunteer for Meals on Wheels and stuff like
Mhm.
that in the community. But yeah, it was an experience for sure.
Mhm.
I think a lot of times people who volunteer also think that they maybe don't qualify because they're used to being the volunteer.
Yeah,
Do you know what I mean?
definitely. Yeah, she did. She, yeah, she did some of that stuff with the elderly too.
Yeah. Is she
And she,
doing better now?
oh yeah, doing a lot better.
Good.
But you know, you jump through a lot of hoops anymore. You know, and you just think, well, geez, you know, what do people do that, you know, are having problems, maybe memory issues or different things like that, unless you have some sort of relatives that can help you. Otherwise, you know, it's kind of hard.
Yeah,
So
it's support.
it's great to have connections here. I've used them myself, and you know, I just think it's a wonderful program.
Yeah, I agree with you. There, a lot of people don't think to come to us until after. And I don't know if Pam mentioned that if somebody is having a planned procedure, they can get a hold of her beforehand so that those things are in place with Pam. So they can contact her before they go to the hospital, when they're in the hospital, or after they return home. Okay. Pam, you have a length of time they have to contact you after they get home, correct?
Yeah, I mean, I usually in the real world before COVID, I would go out and see them where they were at right then and there. But right now I usually try to call them within that 2-day time period. And then I try to get them admitted in that 2-week time period.
So yeah. So yeah, all those good supports are out there. But I think the biggest thing is we've got to advocate for ourselves. We've got to know what, if we have, like I've mentioned, my husband has multiple health problems. We need to understand that disease and where eventually it's going to go and how it's going to impact his life, our family life, how it's going to impact if I get sick, what is my backup plan as a caregiver? For my own conditions, I need to know what it is and what to expect to happen. Of course, life happens and some of those unexpected things come up, but having things thought through so that can go easier in the long run. And I think that was the whole purpose of today's presentation, is to have that in the back of your mind. So Mara, as you're taking care of your mom and your sister, you know, what is our backup plan? What are we going to do if? And what do they want? You know, that's really important too, is to know
Yeah.
what the elderly person wants if there's a hospitalization and things have to change. Sometimes we all don't get what we want, you know. Sometimes that's not the right choice, but, you know, we still move on from there. Terry, do you have any questions? You've been awful quiet there.
No, I mean, you know, she was talking about being planning and being prepared, and it's like, but when you fall and you get the unexpected, I mean, what kind of recourse does a person have, like on that ambulance, Steve? Is there nothing you can do when you find, I mean, number one, she probably wanted to be admitted, probably needed to be admitted, but because of COVID was not admitted, and then is stuck with an ambulance bill.
I think at that point, then you would get a hold of one of our SHIP counselors. They can help file an appeal to Medicare. I've done several of those for ambulance calls. Ambulance calls are kind of touchy, because if, you can call the ambulance, they can come out and render some aid. But if they don't have to transport you, the billing is very minimal or none, okay? Medicare to pay has some very high standards. You have to be in a situation that's typically almost life-threatening, and no other options for transportation. So you can appeal if, you didn't know if the pelvis was broken or, the extent of the injuries. So it's possible, but there are timeframes that has to be done within, unfortunately. And it's a procedure. There's several steps you can go through. If your first appeal doesn't go through, there's, I think, a second and up to 5 maybe. There's quite a number, okay? But you still have to be able to find the documentation you need to set a strong case. Doesn't mean you're going to, but there's no harm in trying. The same thing's true, like if you're in the hospital and you're not ready to go home, or you want to go to the rehab center and your insurance policy, especially the Medicare Advantage plans, are saying, no, we're not going to pay for it. There are appeal processes for that where you bring the doctors in on those. You don't always win again, but you can certainly try. And they have to be timely in their response, because chances are the insurance company is going to want to try to push you out of that hospital. Say you're not ready, and there's good medical reasons you're not ready. It's certainly worth appealing that.
Okay. Yeah, I think she mentioned that there was some appeal process. They did tell her that.
Did she appeal?
I'm trying to think back. Did she appeal? Was she going to appeal? Knowing her, she probably did appeal.
Good.
I mean,
a lot of people say it's not worth the hassle and just give up.
Yeah, and I don't know. I'd have to check back to make sure, but I remember she mentioned that. But you got a cast on your leg. You're,
Yeah, my philosophy.
You're laid up. You're just trying to get better at this.
Yeah, my philosophy with that is if you don't appeal, you'll never know if you would have wanted it. So you might do it. Okay.
Yeah. Okay.
Is there anyone to help, especially seniors, with that process? I know SHIP,
SHIP does. You possibly could get the social worker at the hospital. I don't know if they would or not, but I would start there. Worst comes to worst, you could hire a lawyer or go to the legal hotline for older Iowans. As
Iowa legal aid.
Mm-hmm.
Okay.
Yep. Good question.
Good tips. Yeah. I feel like we've learned so much, you guys. Thank you so much.
Yeah, it was, I learned a lot in putting this together. I was amazed. I thought I kind of knew about going to the hospital, but there was so much more. So thank you for hosting.
Yeah. Thank you. Honestly, very thankful.
So our next Aging Well will be on preparing an estate plan. We have Megan King with Edward D. Jones with us for that presentation. So that's coming up in April.
Yep, it is. Let me know if you haven't already registered, if you'd like to register. So, all right. Thank you guys so much. This is so wonderful. Thank you, Pamela. Thank you, Chris. And thank you, Terry and Madonna for joining us. So have a wonderful day, you guys.
Thank you.
Thank you.
Thank you for hosting, Mara. It was very interesting.
Always. So thankful.
Okay.
So thankful I get to do
Thanks,
these things.
Chris.
Right. Bye, everybody.